Hi guys, I'm Dr. Heidi Goodarzi. I'm a dermatologist and pediatric dermatologist and mama to 3 lovely kids. I want to bring information about dermatology in general, but pediatric dermatology in particular to you. So a typical first step acne appointment in my hands is wash your face in the morning, use your topical medication that I give you, and then use sunscreen. Sunscreen, 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 because every acne mark could get darker or more permanent if the sun hits it. So sunscreen, 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 then sun protection, hat, whatever you need to do, but keep these acne spots away from the sun if you want the marks to go away faster. And then at night, wash your face with a gentle wash, put your retinoids on, and put a non-comedogenic moisturizer on. I would also give you an acid-based wash to put in the shower and wash the active areas in the shower a few times. That is the first line of treatment. If it's more severe, we may start you on the oral version of antibiotic for a few months just to give it a jump start. And we as physicians are well aware of not keeping people on antibiotics for long term, and we do taper you off after a short couple of months or maybe even a month. So what are antibiotics come into play? Why do we use antibiotics? So when you use antibiotics at a low dose, they kind of work as an anti-inflammatory agent. Acne is not an infection. That white stuff that comes out isn't pus. So acne is an inflammatory disease. I keep repeating this, but it's important to know this. And low dose antibiotics work as an anti-inflammatory agent. So they help calm down the inflammation, the zit kind. If you just have blackheads and whiteheads, you don't necessarily have to start you on antibiotic, but we do for the inflammatory acne. And sometimes the topical version is enough. Sometimes you need to take it by mouth. There are potential side effects with any medication you take, including Tylenol. So you do want to talk about pros and cons of taking medication with your doctor extensively, see if the benefits outweighs the risk for your type of acne and your lifestyle, and then decide if that's the right treatment. There are people who have acne that is severely affected by their hormones. Now, every type of acne is affected by hormones because hormones run our bodies, right? During puberty, the hormones are up and down, so most people get bad flares of acne that time. But there are some types of acne that are more under hormonal control. And as a dermatologist, we may decide to do blood work to determine that, or we just may, based on clinical appearance, decide that this is more of a hormonal acne. And then we have hormonal medications to help. Traditionally, everybody thinks about oral contraceptives for hormonal acne, but now we can use medications such as spironolactone that are not hormonal that help hormonal acne significantly. And then there is the holy grail of all acne treatments. The closest thing we have to cure acne is isotretinoin Accutane. That is the one medication that gives you a chance of clearing acne and not ever getting acne. Discuss this with your physician, discuss this with your healthcare provider. Obviously, you can't even get it if you're not under the care of a physician that is registered with the National Registry for isotretinoin, so you can talk about it with your physician. And what about that occasional zit that pops up? And I don't know why it always pops up at the most inconvenient time, at the most inconvenient location. Like you're going to a meeting, a zit pops up here. You don't even get acne. All of a sudden, that little pimple just decides to pop up. What now? So it's not usually fair to put someone on long-term treatment just because they get a zit here and there. But we do have a magical solution for that. We inject a little bit of steroids into that spot, like literally a drop or two, and it makes it melt away and go away within 24 to 48 hours. We call it the prom treatment. I call it the meeting treatment. Somehow as a dermatologist, every time I'm due to go to a meeting, I get a pimple. Well, we know acne is caused by stress. So I guess whether you're going to prom or a big meeting, giving a big talk, you're under stress, so you may get that pimple. But ask your doctor about injections that can make your acne go away, that one pimple go away very fast, so you're ready for your meeting or your event. And then devices. We do have laser treatments that are good for both acne and acne scarring. There are heat-based devices, there are some home treatments. In general, there's a wide range of devices. Some of them are effective, some of them are not. but usually in the hands of a dermatologist, you can be reassured that you get a treatment with laser or light therapy that is going to help you. Medical treatment for acne takes time. One of the things that I have to constantly emphasize to my patients is be patient. Don't give up on your regimen unless you've given it about 8 to 12 weeks. So when I see you for acne, I don't even want to see you for another 2.5 months, because I don't want to hear how it's not helping until it is helping. And why is that? Because a full skin cycle for the skin to come from the base layer to the top and shed is about 14 days to come to the top and 14 days to shed. So you're talking about 28 days for one skin cycle. You want the medication or the treatment to be on board for at least 2 cycles to see if it's working or not. So it's not like you're gonna start a treatment and your acne is gonna all go away. Be patient, stick to the program. Don't jump from one treatment to another treatment unless you've given the first treatment a good chance. Also, spot treatment isn't gonna work. All of acne treatments are aimed to prevent acne from coming on. Once they come on, other than those injections we talked about or putting medication on it to dry it out a little bit, there isn't much else you can do. So we're doing preventive treatment. So it takes a while to see that into effect. The other thing I do in clinic, on the first session I see a patient, is point out to them which lesions are inflammatory acnes, which lesions are comedonal acnes, which ones are blackheads, which ones are whiteheads, which ones are the pimple zits, and which ones are color change from old acne, and which ones are diabetic scar, because we want to make sure that we set our expectations correctly. Sometimes people come in and expect that with one set of regimen, with one set of treatment regimen, not only their acne goes away, not only they don't get any new acne, but their skin clears up completely and all those marks and all those scars just go away. And that doesn't happen. All of the treatments we talked about today are for acne treatments. Acne scarring is a whole nother discussion that we will leave for another time. But the best thing you can do for your acne scarring is prevent getting new acne. So treating your acne is in a way the best thing you can do for your acne scarring. Using sun protection is another great thing you can do for your acne scarring so they don't get worse before you have the time, the energy, the resources, the money to get the proper treatment for your acne scarring. Acne treatments usually very reasonable. Acne scar treatment usually very expensive because they involve devices and lasers and so on and so forth, and they require multiple treatments. And it goes without saying that you really need to stop popping your zits. Easier said than done. I know that, I've experienced with that, but it really makes for the acne scarring to be much worse. So cover it with these acne patches, which kind of sucks this water out of it and makes it go dry a little bit better. Cover it with any acne medication you have because they're all drying in a way and it kind of dries the zit faster, but try not to pop your acne, please. Another question I get is that how early do I need to go get acne treatment? The minute you notice any form of acne, whether it's comedonal, inflammatory, scarring, you need to see a dermatologist. One acne scar is too many acne scars. It breaks my heart when teenagers come in with a face that is full of acne scars and they have gone 2 years trying on their own random things and only now they decided to come in to see a dermatologist to treat their acne and acne scarring. I'm not a magician, so please don't wait that long. Take your children, whether they are 10, 11, 12, right now puberty is happening a lot earlier, so we see acne developing a lot earlier. We do have safe treatments for every age. We will start your child on an age-appropriate treatment, but it's important to get them started early. We even have a condition called infantile acne, so we can even treat acne in your newborn. We know how to treat acne in your pre-adolescent or adolescent. So trust and go see your dermatologist or pediatric dermatologist or your pediatrician. What about lifestyle changes? So anything that makes your body healthier would help your skin be healthier too. I don't know what happened in our culture, but we kind of separated skin as an organ with the rest of the body. Like we have 17 types of like skincare on our counter, but we could care less about what we eat or exercise. So think about it. It's just one of your many organs. If your body is healthy, your skin would be healthy. So do exercise, have a healthy diet, manage your stress, do whatever you can to maintain a healthy lifestyle. We do know acne is aggravated by stress, so that's really important to manage your stress the best way you can. Some people think that eating certain foods like pizza or chocolate contributes to our acne. There are not many studies that prove that, but if there's certain things that you eat and you always have a breakout, by all means avoid it. I just can't recommend it because there's no evidence-based medicine behind it. The one thing we do know aggravates acne or causes acne is high sugar food. Food that dump a whole bunch of sugar into your bloodstream at once. High glycemic index food. So I always use this example with kids is that if you're gonna pick one, I prefer you eat chocolate, especially darker chocolate, over Skittles, because Skittles is just a ball of sugar, but chocolate has fat and other things that is kind of mixed up with the sugar, so it doesn't dump a whole bunch of sugar into your bloodstream. So sugar is the enemy. So for many health reasons, again, not just your skin, avoid eating sugary or high sugar foods. Sodas need to go. The other thing that we know causes flares of acne is fat-free milk. So I know it sounds ironic, but something about reducing the fat in the milk and leaving it with a high sugar content causes breakouts. If you're the type of person that have experienced that dairy makes your acne worse, by all means, choose whatever healthy diet you want to, but restrictive diets could be very harmful, especially for kids and teenagers that are in the growing and developmental age. So as dermatologists, as pediatric dermatologists, we do not recommend restrictive diets. We do not recommend that you take anything out of the diet other than high sugary food or unhealthy food, just in general, just whatever your pediatrician says, that's what we would say too. So if I wanted to summarize acne tips, it would be these 5 things. Acne is a medical disease, so you need to seek medical care. Not popping your zits, using sunscreen, and treating the actual acne are the best things you can do for your acne scarring. Maintain a healthy diet and a healthy lifestyle, and manage your stress to the best of your ability so that your whole body, including your skin, can stay the healthiest. That was a lot of information, but that's kind of what I talk to my patients about, so I wanted you guys to know it and have heard it. Please comment below, let me know if you have any questions, subscribe to my channel, and let me know what videos you want to see in future. Bye. No, niacinamide serum on its own does not cure acne. And if one more person walks in and says that I use ordinary because I learned it on TikTok, I am going to bang my head against the wall. And no, Hiram is not a dermatologist or a skin expert. Ooh, I'm not supposed to say that on YouTube, but there you go, I said it.